thank you all for being here and listening about our conversation and how to better educate our residents. I'm a current PGY3 at the University of Alabama. So, by show of hands, how many people have learned to do something using a YouTube video? I think almost everybody, yeah. So I have learned how to sew on YouTube and also do several household projects around my house. So I've used it heavily. How many people have learned or reviewed a medical skill or concept using YouTube or other training videos? Okay, so maybe a few less. I'd say that a lot of medical students are now learning using video-based lectures. In fact, our medical school has gone to having more pre-recorded lectures and then small group meetings, so they're not actually in a lecture hall a lot of the time. There's obviously data that's been published about this, and I use Doctors in Training as well as the Pathoma series from the University of Chicago to study for step 1, and then there's online med-ed, so I think this is becoming more widespread and common in medicine in general. So, as you all know, radiation oncology training involves many different aspects. It can be very complicated, and we have a little bit of training in the kind of initial consultation as medical students and maybe some of the follow-up, but the middle steps are completely foreign when we enter radiation oncology. So how do we implement video-based learning in radiation oncology? So I think one of the problems I had with starting training is what Dan had kind of talked about with the curriculum carcinomatosis. There's just so many different resources and so much knowledge that we have to obtain as quickly as possible. These are just some of my favorites. And I think that the other problem that we don't discuss a lot is how many new medical studies are published each year, as opposed to 10 years ago when there were a few hundred studies that may have been relevant in the field of oncology. There were 30,000 in 2008, about 30,000 in 2017. So we're really getting overwhelmed with the amount of knowledge, and like Dr. Schuster was saying, we're now expected to really synthesize all of that data and be able to discuss it with the patient in 30 minutes. So the problem, of course, is we have busy clinic schedules, academic responsibilities, and at the current time, at our institution, there's no formal structured training, which the IROC is addressing. And there are sometimes limited scholarly educators at our smaller or newer programs in radiation oncology. And to some degree, I think that residents and medical students are expected to figure it out because we're supposed to be intelligent people. So IROC has already addressed the solution A that I think is necessary, and that there's a basic structured educational forum for radiation oncology residents as we start. And then one of my second solutions, which Jenna has already touched on, is some kind of technology that is able to help us learn on our own time. Maybe the things that are not able to be taught in a clinic when we're busy trying to take care of patients and get them to treatment. I don't know what I just did. But I think that it's important to have some resources that are learned on your own time so that residents can learn in different modalities. Some things that we have now, of course, are eContour that Jill and Aaron have worked on. And I want to talk to you today about two things that we have implemented at UAB, which are some Eclipse training videos that are very practical how-to that we're planning to incorporate with our IROC this year, and then the Quadshot News. If anyone's heard about it, you'll hear about it today. So we had a department-funded project that incorporated physicists, physicians, and dosimetrists, and we developed these very practical how-to videos in Eclipse, which is what we use for planning. So we talked through contouring, how to put on beams, because I remember it was very daunting when I had to put on whole brain fields in my first week of residency. I had no idea what I was doing. Treatment planning and evaluation and image guidance, which I feel like is another thing that's expected that you kind of pick up and learn as we go, but there's not as much formal training with that, and that is also in the IROC curriculum as well. So this was integrated into our orientation last year, and then is provided on our share file in our institution for new learners, because a lot of these things are not only relevant for the physicians, but for our dosimetrists, for our therapists, for any new staff, for anybody who needs to learn how to use the contouring software. So today I want to show you really briefly some of our treatment planning and treatment evaluation videos. So I'm hopeful that this will work. So this is our physicist, Dr. Elizabeth Covington.
Right-click this upper
and she's
right
just talking about how to get the DVH to come up, because that is a struggle when you're a PGY2 and have never used the software. And so she's showing you how to manipulate the software and
screen by
highlight all of the contours,
so that you can see all of your contours.
Unclick all
to
of the
easily
contours.
toggle all of them on or off, you can right-click Show DVH and say Show all DVHs. You can also hide them all.
So very basic, but very relevant for a PGY2 that has no idea what to do with the software. And then we also have some that are a little bit more clinical based, and this is Dr. Fivash, who's one of our CNS attendings, talking about how to evaluate conformity index, which is also a foreign concept when you start.
Metric of plan quality that I want to mention is the conformity index. You'll see it also as the conformality index. Some people will refer to it as that. But
so for interest of time, I'm going to skip over that. But we have a bank of these videos that we've now provided for our residents in ShareFile. And we actually record our didactic lectures, which is also a nice resource when we're going back to study or when you're preparing the next year's lecture. We have those. So when we were working on this bank of videos, we were really focused on identifying the resident learning needs. First of all, being practical videos that were how-tos. Second of all, physics, radiation biology, and clinical information. So we did record our didactic lectures. We've also compiled video resources that we have quick links to for the Astro annual refreshers, webinars like the Meet Me in Treatment Planning, and those types of things. But I think importantly, if we have resources like this, which is the whole point of today, and talking about collaborating and disseminating them, whether it's via cloud resources or just having this opportunity to collaborate together, that's really important. So if you're going to record videos, I just wanted to give 5 tips. It can be done on your own computer. I actually used QuickTime to record my screen, and it records your clicks so that people can follow you on the screen. We can edit using either iMovie, or if you have the ability to buy the software, Camtasia is really nice. Recording is also very easy, but find a quiet place so that you don't have background noise. At the hospital, I had a lot of trouble with the sirens, so I ended up recording at home. And it's best to use a microphone or a headset, something if you have it available. Gaming headsets work really well if you have one of those at home. And it's just really important that you start at the basics, assume your learner knows absolutely nothing, because I know as a PGY2 resident, I had absolutely no idea what was going on for about the first month. I think that it's best if you keep the videos really brief, because short and to the point, if you have a 10 to 15 minute window that you can go back and review or watch something, that's a little bit easier for a resident to commit to, or a new staff member, so that you can pick up things very quickly. The last thing I want to talk about is a new initiative that my co-residents and I have started, and it's called the Quad Shot News. Catchy title. It's delivered to your inbox 4 days a week, and they disseminate original content that summarizes the latest cancer research for the week.
So it's not BID over 2 days.
It's not BID over 2 days. They take what's recently been published, they create catchy or funny, I think, content in need-to-know format, and they link it to the publication. So if any of you read the Skim as females, it's fairly similar to that. And this is what it would look like in your inbox. It shows up, and it comes every morning at 5:30 Central Time. So if you wake up, you can read the Quad Shot before your shower. And it is free. I want to take you to the website real quick so that you can see what it looks like. And, oh, it's not going to pull up. I'm sorry. I didn't warn you about that.
That's not Dan.
That's not me. Sorry.
Well, it sort of looks like that, and you can see the most recent post from the morning, and it links you to the PDF at the published website. And each week they send out a quiz so you can test your memory of what you've read. That's pretty much all I had, so we can